The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Good morning, everyone. My name is Dr. Charlene Ortiz, and today we are going to continue with our lecture of what is it that motivates us. Previously, we talked about aspects such as drive and different types of drive. So, for example, hunger and sexual arousal. And today we're going to continue with what drives us. We have talked a little bit about drives before, and today we're going to talk a little bit more about achievement motive. And when I am referring to achievement motive, what I am referring to is that idea that some individuals have that they must master difficult challenges, right? So not just your average challenge, right? Your average difficulty, but here you're trying to focus on something that is immensely difficult. These individuals also may have a need to try to outperform other people. So notice we're thinking a little bit more about, say, for example, academic achievement. We're talking about sports, things of that nature, where you're trying to master something immensely difficult. Because of that, because you're holding yourself to this standard to try to outperform other individuals or master difficult challenges, notice that you are going to set high standards of excellence. You're going to set up very high standards. Now, how is it that we know this information, right? Well, back in the 30s, we started developing measures to notice the apperception that individuals had, right? What are those underlying themes that lead and guide that behavior? And how did we do that? Well, we did that through the thematic apperception test, Some of you may already know what this is because we didn't have a name for it as of right now. But notice that some of you have seen these type of assessments, these types of tests. When we're thinking about a TAT, we're thinking about a projective test. As the term suggests, a projective test is that in which the individual projects their underlying unconscious, unknown factors, emotions, trauma, feelings about his or herself, right? Notice that your exam this upcoming Friday is an objective test because there's no room for interpretation. The answers are right there in front of you. You have A, B, C, and D. Notice that that would be an objective test. Whereas when we have a projective test, the answers may not necessarily be as clear. Because of that, because it is ambiguous, because the presentation of those items, instead of being objective, are ambiguous, we have the opportunity to see what is it that that patient or that client is trying to interpret. And I'm actually going to give you a really fun example of real assessments that we utilize in practice. Now, notice that it is very difficult, very, very difficult to become trained and utilize correctly projective tests. Usually it does take a lot of training to be able to administer correctly and interpret correctly you as a practitioner whenever you are exposed to this type of assessment and you give it to your own clients or patients. Now, generally in projective tests and individuals who have that achievement motive, notice that something we can observe is that these individuals tend to work harder. These individuals will attempt to work harder and more persistently on task. Notice that they are more likely to delay gratification. That comes from long-term goals. And what does this mean? Even though the person is highly motivated and it's highly engaged in solving a very challenging task, the issue, however, is that they may not be able to understand that long-term gratification. For example, you guys that are here in an introductory course, it is really difficult for you guys currently to view, okay, this is going to lead to the satisfaction of graduation, right? Because that will be a very long-term goal. Because of that, if you use achievement theory, you may be able to pursue short-term goals easier. So for example, getting an A in the exam, that is short-term, that's in a few days, right? Whereas graduation, that's in a couple of years. So if you're engaged in achievement motive, it may be a little bit difficult. Now, something we have learned is that higher educational attainment and greater success in business tends to be related to achievement motive. So if you are pursuing those careers, for example, those in business, this may be a good way for you to look into those short-term goals. Any questions about that? Good deal. So now I'm going to pull up some examples of the TAT. Remember, there's a wide variety of exams or assessments, tests, I should say, that fall into the category of a TAT. So let's pull those up. And you're thinking, why is it that I have to give a projective test, right? Why can't I just ask the person just like I would in an objective test, right? Are you sad? Yes or no, right? So that's a very objective examination. Sometimes it's not as easy to be able to express our own emotions in that fashion. Also, even if I am aware of my own trauma, thoughts, emotions, anxiety, some of the factors can still be underlined. So that is why we provide this type of assessment. All right. So this is one example that we would provide to an individual, right? That we would provide to a person. Notice that in this specific case, the image is ambiguous, right? This image is ambiguous. It's not necessarily very clear what I am trying to show this person. What we can see is that our two individuals, right? The one person is holding his or her head against another person's shoulder. Now, the gender may or may not be necessarily easy or stereotypically easy to identify which gender or which gender expression these two persons have. Notice that I would present a stimulus like this one to explore, say, for example, the client's or patient's perception with their relationship with men and women. This can also show me latent hostile needs. And notice that I use the term latent, right? Because the individual may not necessarily be aware that they themselves have hostile tendencies. So that would be another reason why I would show this item, this stimulus or stimuli, if I were to show more, which would be indeed the best approach. Notice that in regards to other aspects, I may show this image to explore whether or not the individual has some underlying factors of being gay or lesbian. As I mentioned, the term homosexual or homosexuality is a dated term. We do not use that term anymore because that term is generally associated with a mental illness. And as we know, because science is able to be revised, we understand now with more research that being gay, lesbian, bisexual, things of that nature is not a mental illness. Now, any questions? Any questions about that? Good deal. So let's give you guys another example. This one is another one that I particularly liked, right? This one that I particularly liked. Because notice that I am presenting a road and we have a long path along this bridge. Now notice that we have an image that almost appears like there could be or not, there could be a dragon in this image. Notice that I would utilize this presentation, this image here. I would use it, say, for example, to explore primitive fears, to explore aspects that have led to fear in a very, very primitive, very archaic, very past type of fear. We can also look at this if the person has fears of being assaulted, being attacked, right? By the same token, we can also utilize this image to explore factors of aggression. Notice the actual image is not objective, right? The actual image is not objective. Are you angry? Are you afraid that someone is going to attack you? Notice that that is left up for the interpretation, and rather, I should say, the perception of that client or that patient, and not my perception. So any questions about that? So the last example that I want to give you about a TAT, notice that we have, in this case, no individuals. There are no people, no human figures present in this type of stimulus. Notice that I can utilize this to explore the client's perceptions of suicidal tendencies, suicidal ideation, or morbid rumination. And I can also utilize it to explore feelings of depression with that individual. Any questions about this type of test? Yes, ma'am.
How do you know just by the pictures? How do you know just by the pictures?
I know we're the individual. So one of the things that we do with thematic testing, remember that it is a projective test. So what we do is that it is administered to, for example, a general population, and it's also administered to individuals who are mentally ill. Generally, what you're going to start observing in research whenever we are developing this type of assessment, what you're going to start observing is that there are specific themes. Now, the general population can explain these images in a certain way. Whereas when we're doing research to validate this test, individuals who are ill will present other things. That's what we call qualitative research. So through qualitative research, we can explore how the applicability of this test. So we do a lot of qualitative research for it. Does that answer your question? Yes. Good deal. Good deal. As I mentioned, thematic testing is immensely difficult to administer because it is really hard to try not to put your own input in the presentation of that stimuli. But what makes it really, really hard is your interpretation. You want to remain as objective as possible. So to teach you all of those different themes that I was talking about earlier, yes, it would be immensely difficult to learn. However, they are immensely beneficial. They are immensely beneficial. Now, what motivates an individual could be other aspects of incentive, right? The value that we assign to an incentive. So something to remember is your tendency to follow through and achieve a specific goal is going to be based in a wide variety of factors. The first one would be the actual strength that you have. How strong is your motivation, right? If you're simply not motivated, it's not happening, regardless of the type of incentive I provide to you. So if I say, hey, participate in this research and you get an A, well, if you simply woke up this morning and you said, I don't feel like doing that, you're simply not going to do it because your strength, your own motivation is not there. So that would be perhaps one of the most important factors. Now, another aspect that's going to contribute to your achievement of behavior, right? To engage in that behavior so that you can achieve and accomplish a goal is also going to be based on your estimation. Your estimation that you're actually going to be successful, right? What's the probability that I'm going to do okay? That I am actually going to succeed? Now, Another aspect is incentive value. Another contributor, I should say, as to whether or not you're going to engage in a behavior is incentive value. Sure, I can give you an incentive, but it's going to depend on how you view that it is tangible or it is not. Are you actually viewing an actual reward for yourself should you engage in this behavior, right? So in keeping with our example of if you do this research, you're going to get an A in the class. First of all, we talked about that you need to be motivated. The second thing, for you to engage in that study, you would also see what are the chances that I'll be successful, that I'll be a good participant. And the incentive, right? Is an A worth your behavior or is it not? Now, notice that situational factors are also going to contribute. They're going to explain why is it that high achievers generally prefer tasks that are intermediate, that are kind of not really. They're not that difficult. Why is that? Well, generally, a person who is a high achiever has, for example, determined if it's immensely challenging, the probability of me succeeding are lower. Maybe that leads to a lack of motivation if it is too high, if the reward or the risk is too high. So any questions about that? All right. Good deal.